The high street pharmacy Boots says sales of COVID tests have risen by a third since the start of July. So is the virus back? Well, let's take a look at the stats. And here we're relying on data reported by users of the Zoe Health app. Just under 790,000 people in the UK are estimated to have had COVID symptoms as of the 29th of July. Rates are currently highest in the southwest of England, with an estimate of between 931 and just over 1,600 daily new cases per million people, with Wales not far behind. They're lowest in Yorkshire, with somewhere between 328 and just under 1,100 new cases a day per million people. These are huge ranges, so there is uncertainty of the actual number. But let's put that into context. This charts the roller coaster of reported infections going back to November 2021. And here's the recent uptick in cases, but that's dwarfed by the really big peaks of Omicron in the early months of 2022. The recent rise in cases is mirrored by a 46% increase in patients testing positive when they're admitted to hospital. So why are COVID rates up now? Well, waning immunity will play a large part, with less virus circulating. It's many months since many people have had an antibody boost from infection. It's even longer since most had a dose of the vaccine. Last autumn, everyone over 50 was urged to have a booster, but uptake was just 40% in people in their early 50s and 52% in those in their late 50s. It's only when you get to the over 75s that uptake climbed above 80%. The over 75s were also eligible for a booster in the spring of this year, with 70% taking up the offer. So their protection against serious infection is likely to be holding up, but protection in the rest of the population is falling off. COVID is here to stay, and with a wet July forcing us to huddle together indoors, the virus has seized its opportunity to spread